She can voice over whatever is on there, right?
Yeah.
How long does a typical hookup take
Oh, it depends on how long you've been doing it.
for you?
Oh, I'd say I could get it done in a half hour, 20
Oh.
minutes.
So I suppose for me, coming in for the study here would be better.
I would say so. The ones that we have done the home studies on are like patients that are still over in the hospital, or we can't get them in the hospital, you know, or they refuse to come in.
Oh,
You want to
No,
show
got
the...
it. Yep.
Okay.
Patty said there might be openings fairly soon as
Yeah.
far as the setup.
Yeah, I mean, I would say so. Okay, so I got my, the 01, 02.
Okay.
So then I'm just going to go from here to here to here, and I'm going to take my half. So that's my first mark of my T3, just to help you when you're redoing it. And then 12, and then I'm going to do, there's your first mark of your, and then you can just make that along that line. Okay?
Okay. For the F's.
Mm-hmm.
Okay.
All right. So now did those. Now I'm going to do my C's. Take my 10%. Go here. Here. There, I got my CZ.
Okay.
Okay. And go 10% up. So when I've done that, I've gotten my second mark there.
Mm-hmm.
I got my second mark there.
Okay.
And so from there to there, I will go up. Do my first mark. Helicopters out.
Mm-hmm.
There's my first mark. Okay. So now then I go from here through here to here, and I take half, and then I get my C3. So then when I'm there, I come here and do my, this will be the beginning of my F3.
Okay.
Okay? And while I'm there, do my next mark there, okay?
Okay.
Then to get those other marks, and this is when I come and I do the old, from here, through that mark, through this mark, this mark, this mark,
Okay.
And then if you take half of that,
Okay. So
then that gets that's your FZ.
Okay.
So then from there, I can go from FZ back here to this one,
Okay.
and that would be, and then there's your mark for your F3.
Okay.
If I do the same thing over here,
A little harder to do with
There you go.
long hair, I suppose.
there you go. So there is your full,
Okay.
there's the measurements, okay? Anything that I need to redo for you?
Nope.
Okay. Now you want me just to go ahead and clean how I would. Okay. What I do first is I do Q-tip, and I just do and I take out the center where those two marks meet, so that gives you that marker where you're going to put that electrode. And I use these up here, Jamie, for the reference and ground is what we do.
Okay. But that's not standard. That's just per.
It's however, it's lab dependent, where you want to
Okay.
put your reference and ground. And why I use alcohol first is because that just gets the gritty, the dirtiness, or not that your head's dirty, but it gets all the oils, you know, all that stuff off. And then what I do then is I come back through, and then I take another Q-tip, and then I do with New Prep. And the New Prep has a tendency to be a little oily, so you don't want to use very much. So when be very, you know, careful, and then this is where you buff up. You don't want to scrub too hard, but you scrub enough. If you don't scrub hard enough, this is what will affect your impedances.
Yeah. Any brain there, dear?
I'm not ready, am I?
Oh, no.
Okay, you let me know if I'm...
I'll scream.
Okay. Just tilt your head down there.
I'm just glad my hair is short. That
Keep
we're
it
missing.
that way till you
Yeah.
study.
Okay. All right, so those are the ones that are on the head. And then what I do is I take 2x2 gauze, and I dip in alcohol. And what I do is I go ahead and take off the ones I don't need.
Okay.
So then those are not... Because those are harder, I feel, to get off than in the morning.
Once they've slept on them.
Yeah. And I think that when you're training them, I think that they need to know you want the patients to leave here as they came in here. There's nothing worse than coming in the morning, and when I meet and greet people, when I walk down the hallway, that I can tell which patients have been here for the sleep study, because we've not taken off the red marks very well. Okay? All right, so now I got off all those marks, and what I'm going to do now is I will do the behind the ear for the M1s and M2. And what you do is look for your bony surface right here, behind the ear, the bony surface. You know, I should probably have gloves on.
Well, we're going to leave that up to them, their discretion. We have gloves available.
Okay, well, I just want you to know because I should have. Okay, with that then, I do the eyes. And so, the eyes are left outer canthus and straight down. So, it'd just be like right there. Remember it used to be 1 centimeter out, 1 centimeter? It's not that anymore, so you just do the left
Right.
outer canthus and just scrub down.
Okay.
Oops.
I'll get that, huh? And then the right outer canthus is then straight, and a lot of times people say that gets in the eyebrow, so you just got to just right above the eyebrow as much as possible. Sometimes it's like right in the eyebrow, but people have bushy eyebrows, so it doesn't work as well. Okay? So then that's that, and then while I'm here with my gauze, then I go ahead and I do the chin. Did you just shave?
I did this morning.
Okay. This
Sort of.
might sting a little bit. So the middle chin. This is where your equipment's, you know, we used to only have to do 2, but now we have to do 3. So then what you do is you have them tilt their head back a little bit, and then you just come down and then over. And then on the other side. Okay, there you go. And with those areas that I just cleaned, then I take and I do the all new prep also. So I go up.
And you just use gauze for that.
Some people use the Q-tips, but you know, it's just whatever your preference is. So, and I'm telling you, it does not take much, you know, at all. Because if you use too much, the tape's not going to hold, or whatever you know, whatever you would use is not going to hold. Like this for me. Don't put your chin, put your lip over your teeth. There you go. Open that space right up.
Get rid of some of those wrinkles.
Okay? Yeah. And then tilt your head back for me. There you go. Okay, so while they're there, I'm going to let those areas just dry a little bit. I'm going to take this. I'm just going to do his EKG patch, okay? So the right goes up, you're fine, and then the left is going to go to the left. So it's kind of like that modified lead too, so you're fine. I'm just going to... Don't want to get it on the bone, okay? And then have you just raise this arm up in the air. A little lower here, look for the rib, come over, it'll be cold. There you go. Get those there. Oh, I spilled my alcohol. Okay, alright, James, I'm going to go ahead and start applying the electrodes, okay? We use coverall. A lot of people use, you know, okay? So, I'm just going to go ahead and start putting on. Reference material. Bob, I promise I will get all this stuff off of you that you will not be,
Oh, okay.
you know, you won't.
Won't look like I've been in a sleep study.
And you're starting with?
I'm going to start with my reference and ground.
Okay.
Come up here. And where those 2 connectors and where I cleaned, I push that down. And then I'm going to put this piece of tape over the electrode. And then if you put it on where the electrode meets the wire, that holds. Nice.
Wow, that's nice.
And the nice thing about this is when we pull it out of the hair, it does not hurt. Okay? Now some people pull their wires up, some people do it all the way down. It's just a preference. Me, I like to do mine at a ponytail, so when they roll at the top of the bed, they're not feeling like they're rolling on the... Okay? I'm going to start, then I'm going to do my centrals. So then where that connected, you're fine there. I don't even put the gauze on there anymore.
Yeah,
It
it's
just-
amazing.
Yep. Your son and daughter both love this bob. So your whole family now has been used as the
Patient.
patient.
Katie got on TV with it. She's on the commercial.
I've seen that. I bet she liked that.
Yeah, she's like, do I get royalties?
Oh.
No, I paid you enough that day.
Did she end up more with than what DJ ended up with?
No, TJ still ended up with a lot more.
I was a guinea pig a long time ago, a couple times.
Couple times.
Yep. And then you also did the infant apnea. One
Oh,
with
that's
Tracy.
right. Yeah,
Remember that with that video?
that's right.
That's right, I forgot.
I see
So-
pictures of that once in a while.
And for the longest time they thought those two were married.
So what's new over there at East, Bob?
Well, let's see. Well,
What's your guys' schedule like?
my personal schedule?
Yeah, like your work schedule.
I'm doing 12s, 3 in a row, couple days off, 3 more, 6 off. That's my pattern. 3, 3, 6 off,
So 3 on, then you get 3 off,
2 off.
2 off, and then work another 3.
Yeah.
And then get 6 off. That makes it very nice. You like that?
Yeah, the 3 in a row gets a little long once in a while, but
Yeah.
it's, 6 off makes up for it.
Well, and then you can just...
I forgot I gotta look through here.
You got what?
I gotta look through here.
Oh. I remember not, last time I was a guinea pig, not going to sleep or even thinking that I went to sleep at all.
Yeah.
I might have to go for an Ambien right off the bat.
Well, then you know what? Then when
Ask
you,
Rich
when,
Muth
when
for
you
it.
talk to Dr. Richmuth, then ask
He'll do
for
that?
it. Yeah.
Okay.
And just tell him that, and he will.
And Ambien won't affect the study?
No, because we have the standard order right now, Ambien.
Okay. But sometimes you have to call them that
Nope.
night?
We don't ever call him anymore. We have a standard protocol. That if the patient doesn't fall asleep like within 30 minutes of lights out, we can give that 10 milligrams of Ambien, depending upon the age. So, if you want to wait for that, we can do that. Or if you want to stay, if you want just a, so then talk to Dr. Richards and say, I think I need a.
Okay, and then I could take it ahead of time.
Well, what he would do is he would write that order, and then what we would do is we would see that order. So when you came in, we would just call pharmacy
You get it right away.
and have it up here. When lights out was.
Okay. My mom got an Ambien when she had her leg operated on at the Heart Mart,
Uh-huh.
and it was $18 for one pill.
Really? $18. So it's just however, and then I guess if you want to see if he'd give you a prescription, and you want to get your own, however you want.
No, I don't normally need
I-
it, but just being all wired up.
Yep.
No, he doesn't need it. He's asleep long before me,
Unless you go to bed early.
like last night. I gotta get you tonight too.
Back here tomorrow, huh?
I don't have any Coban. Don't just keep
Okay.
watching. 'Cause I'm gonna-
Watching it. Watch.
Turn it around so I can see what I look like.
Pretty.
It smells like a dentist out here today. Like
They clean?
aseptic. I don't know if it's...
You've seen yourself before, dear. Pretty.
So I went over and ordered some decent sunglasses today with long distance lens, my prescription lens.
Oh boy, how much?
$60. Normally $350. Insurance paid for $250 or $2 whatever.
They're going to think this is just like a huge tape or a huge wire. You know, remember how the first time when you...
yeah. Well, that's why I'm hoping this seminar is going to work this way with them practicing. So they're
I
not...
think that'll be great.
So...
When are they coming to do that?
A week from Friday.
Do you want me to come and help assist?
No, we'll be fine. We got styrofoam heads that we're just going to be measuring on Friday.
Oh, cool.
They were cheaper than glass. I mean, you can get them from a beauty
Wait,
supply store.
yeah.
And so they're just going to practice measuring. I hope Dr. Liskey can come up and say hi.
How many do you have?
7.
Okay, so here's my first bundle
Okay.
that I first make. And I use Coban,
Yeah, that's cool. I like that.
because then you don't have tape residue.
That is nice.
And it just kind of molds it right in there. Okay? So the next thing I got is my chins. My only... Dr. Liskey's here today if you need to.
Yeah,
do.
so
Okay, I'm going to have you do that. Your lip over... There you go. There you go. You can relax it. I forgot the belts in here too. I'm just real. I forget that you want me to do the whole thing. Okay, I'll have you tip your head back just a little bit.
Back.
Yep, I'm gonna look for that one here. Are you wanting me to use our ThermiSense, the pressure cannula, all that kind of stuff?
do you just have a regular thermistor?
Mm-hmm. But to be able to know that what's the rules, you know.
It's just the putting on right
Okay,
now.
all right.
Okay, it's just
Okay.
the setting up.
Okay.
Did you find any thermocouples or?
I have, Jamie, old ThermiSenses that don't work anymore. They just don't plug into, they don't plug into the, we don't have one of those ThermiSense boxes that have gone, but at least that would be the thermistor part. So I have plenty of those.
If I could get a couple of those.
Yep.
I found 3 thermistors
Okay.
and stuff that you had given me. So.
Okay. And I'm gonna, when you do that, Jamie, make sure you tell them, like here,
Tapes should not cross.
Tape should not touch. Okay?
Because it causes like a salt bridge? Is that
Mhm.
what it was? Okay.
So then that's my last 3 of my gold electrodes. And then what I do is I do a final Coban.
And you don't put the chins in there because for like an MSLT, then you can just pull those off? But
No, we use chins. I just like to pull them up together, and I do the chins last.
Okay.
So I just have like 3 groupings. It doesn't, I mean, like
Everybody's
I said, everybody's different. And then what you can do is, you can do this. So then all your wires are in a nice little bundle. Okay?
Pretty.
So the next ones I'm going to do is my EKG. I'm going to come through his shirt, and I'm going to just put that right there. And then, Bob, I'm going to raise that arm, and I'm just going to drop this down through your shirt. And where I cleaned, right there. Okay, there you go. I felt so embarrassed that I called Rob Marcus. You'll have to tell him I felt so bad. Okay, Bob, I'm going to have you just pull up your pant legs for me. You can just pull them up to the tibialis. There we go. On both sides. Those are some beautiful boots there. Yep. Okay, pull out your leg there. Now pull your toe towards me. There's the anterior tibialis is that muscle right there.
And that's just alcohol?
Mm-hmm. Alcohol first. You can relax that one. Pull this one up. Flex this way. Find that muscle. And then I'm going to give you a little, if you take this and tell them to paint the hair down when at the final, then when you pull those off, it will not hurt. Kind of like a Band-Aid. Come back up for me here. And then this will be my last one. Okay. I'll do this one and paint that hair down. And that's a good little tip.
Don't lose any leg hair, that's for sure.
You know, that's a tip that I learned, Bob, when I went and took my test. We used to have to do clinical, like, you know, for respiratory we had clinical sims. I had to go do live patient hookup out in California. And that was one thing, because they said, if you remove anything on a patient and they say, ow, you will be docked.
Ooh. And
that would be, you know, counted against you. I'm like, well, how can you do that? You know, of course they always find the hairiest people, the curliest hair people, that type of thing. So this one guy gave me this point, you know, take your hair and take it down. So it's like, wow, that was a good
tip.
Yep. When I do my studies, Jamie, I still like to tape.
The legs.
But that's just, you know, just because I don't like to go in, you know, at night. Okay, now, if he had shorts, what I would do is I would run this up, everything, but what I'll do is I'm just going to take this fob, I'm going to just run up through your shirt.
Okay.
Like that, okay? There you go. And we'll just do the same thing with this shirt. There you go. So now is where I plug in my EKG. Okay. And then my legs. So left leg. Right leg. No, we always try to label everything. Left side is always an odd, you know, even though left is always the F3, but we always try to do like the left side always doing an odd number type of thing, just to keep everything with odd. Now this is where then I use my last Coban strip. And you can take this, give them plenty of room so when they move around. And then you just can take this and do a little bit of a wire management so that you only have then 2 bundles.
Nice.
So you have this bundle and this bundle. Okay? How's that? That doesn't look too bad, does it? I'm going to go get the belts and I'll get that, okay? So you just keep recording on them.
Now we just wait for the governor to call with a pardon.
Not going to happen, dear.
I'm innocent.
Yeah. Keep trying to say that. It's only a half hour so far. It's only got 3 things left.
Alright. I don't know if I can sleep like this, but
You won't.
if I stay up the night before.
Yeah, right. That's not going to happen either.
You try. I mess with my sleep schedule a little bit. Try to be tired when I come in.
You will be, honey.
I won't?
You will be.
Oh.
If you see the clock, you will be.
Get up at 5 for sure that morning. Yeah, I thought there was like several months waiting list, but
Not that many beds.
maybe get in next couple weeks. She said the boys work on Sunday and Monday, Tuesday, Wednesday.
The boys,
Yeah.
well, Rick works Sunday, Monday. Adam works Sunday, Monday, Tuesday. No, Adam works Monday, Tuesday, Wednesday. Okay?
Why do you want the boys?
I think you would work, I mean, Gail would, but I guess if you don't, I'm sure you probably know Gail. You probably know Gail?
Gail.
Beck?
Yeah, she used to work with Brian.
Yep. I mean, she works the Sunday, Monday, Tuesday. She's awesome. But if that would make you uncomfortable, I think Adam would be really good. I think you'd really like Adam. So.
Wouldn't make a difference really if it was Gail or not.
Angie would be awesome, you know. So, it's whatever.
I don't know her, do I? Angie who?
Angie Barnett.
No.
Yeah, she knows you. She went through the RT program
No,
and
did she?
went through the sleep program then.
Okay, just sit right there. What I'm going to do is I'm going to have you hold this on your chest. Now you are going to tell them that these piezos are no longer able to be,
We're just
and these are huge.
We're just simulating plugging in the belts.
Yes.
What's used instead?
We have to use, it's called,
That coily.
those coils, that those respiratory inductance plasmography. It's like a PFT machine. It does actually like a flow volume loop. So that's a little snug, but is that okay?
Yeah.
Okay. So that goes on the upper chest, like that. And then the abdomen one.
I'm going to stand up for this.
Oh, yep, you can. Here, let me. And I pulled that chair away, so don't
sit down.
Don't be sitting down.
Okay.
Jamie, when we do the inductance plasmography, we do the top one on. We can do it on the shirt, but we prefer to do the belt one on the skin. But I'm not going to do that with you. Okay. So we just hold that there for me, Mom. We'll wrap it around. You want to grab that for me?
Got it.
Got it? Let's snap that in. Here, I'm going to twist it there. And then that snaps. Let's take this, and we'll there we go. Okay, and then what you do is you would take both of these and wind them up the. You can go ahead and now slide back and sit back down. There you go.
Are we going?
Yep, you're not going to fall apart. And then so we don't have to worry about this though when we, do the other, but this just kind of gives the impression of how you're.
Of how they should be. Yeah.
Just trying to make it so there's less wires for the patient to get tangled up in, okay? So that's the chest one. And the last one that I have, you want me to do the oximeter probe?
No, that's okay. The
All right.
oximeter probe, and then the.
This would be this one. This is what our ThermoSense is. And this is what plugs in. We put it into a cannula. So this is what monitors airflow. Then the cannula is what monitors airflow for pressure. Okay? But this hooks into that. So what I would do is I would just take that like that and then hook that around.
Okay.
Like that. Just kind of like a... There.
Yep. Nope. That looks good.
So what we do, Bob, is we do, it's gotten so with the new rules, we have to monitor airflow 2 different ways. We have to do it by thermistor that monitors the temperature, the inhale and exhale, and then we also monitor with a cannula that monitors pressure.
So you have a cannula too.
Yeah, and so it's not like an oxygen cannula, it's more like a pressure, it looks just like an oxygen cannula, but it doesn't hook up to oxygen, it hooks up to a different little box. And so what happens is they feel when someone's having a hypopnea, that's a partial obstruction, the pressure changes so much where breathing, if someone opens their mouth, the pressure cannula loses, and then we pick up the snoring, so we use all different type of channels to figure all those different events
So
out.
then if it's positive, then you put the mask on over all this
Nope.
stuff.
What we do is